Welcome in to Your Health, and we are very fortunate to have with us today Dr. Steve Suggs, and Dr. Suggs is the director of the Stroke Center at Baptist South, and this is something that pertains to all of us, especially our audience, a little bit older, but actually everybody.
Can happen to anybody.
And we're going to talk today about the symptoms of stroke and some preventative measures. So thank you so much for being with us, and let us first start off with, what are some of the symptoms of a stroke?
Well, I appreciate you having us here today, and this is Stroke Month, so it's a very timely time to talk about the symptoms of stroke and how we go about managing it. Stroke, as you can imagine by the name, is a fast, sudden onset situation, so typically the symptoms happen quickly, and we use the FAST scale at the hospital to determine if somebody's having stroke symptoms or not, F-A-S-T. And that's a good way at home to think about symptoms as well. Is the face symmetric, F? So we got a facial droop on one side, that's concerning for a stroke, we need to get checked quickly. Arms, A, are the arms moving symmetrically or not? And then speech, is there speech affected or not? And the T is time.
Yes.
So F-A-S-T, face, arm, speech, and time. And the important thing to recognize is if you have any of those symptoms, you need to get checked quickly. And that does not mean waiting to see if they're going to get better or not. It does not mean calling your doctor's office to see if you can get an appointment, which we all know is not going to happen real quickly.
That's right.
And don't call your family member and ask what you need to do. You need to call 911. Because we have a paramedic EMS system that's geared toward getting patients to the hospital quickly to get an assessment. And all of the hospitals in our region have been assessed for their ability to care for stroke. And so if you call 911 and they have your location from the 911, they're going to send the paramedics to pick you up and take you to the closest hospital that can treat stroke, and then let them figure out the rest of it from there. Now also, the other thing typically that happens is stroke in general affects one side of the body. So it's usually, face, arm, and leg on the same side are affected, or the vision going out on one side, those kinds of things. So sudden onset of any of those symptoms, and if you can think, if you're coherent enough to think F-A-S-T, fine, but if you're a family member with a person that's having it, you think through that as well, and if any of that's concerning, call 911.
Because that's like I was telling you earlier, I was sitting next to a guy at a meeting and I saw that happening. He thought everything was fine, but I recognized it and we took him to the hospital.
Yes, sir.
Yep.
Exactly.
So the most important, when I listen to this, identifying those symptoms that you've listed, that last letter, T, time, that is probably the most critical element in being able to survive that stroke and come out all in one piece.
Yes. Time is of essence, and we have a medication we give for stroke called TPA, and essentially it dissolves blood clots. So we think most strokes, about 87% of those that cause a blood vessel to be blocked so that the arteries aren't delivering the blood to the brain. And if we can get a patient in the hospital to the emergency room and make an assessment within 3 hours of when their stroke starts, we can give that medicine, dissolve the blood clot, let the blood flow get back to the brain, and hopefully help the patient improve. If we're able to do that, there's about a 32% chance the patient's going to have significant improvement, if not complete recovery. If we don't do anything, there's a chance of significant severe disability and nursing home care and even death from stroke. So it is serious business.
Well, and to be debilitated permanently is just, it's an awful thing when there actually is something we can do.
Absolutely.
And just, would you give us maybe the top 4 or 5 things that we might think about doing to prevent stroke?
Absolutely. So stroke, interestingly, used to be the 3rd leading cause of death in the United States. And it's just been bumped down to 4th because as a society and as a nation and as a medical community, we're more aggressive about treating the risk factors and for preventing stroke. And so those things that you can do are keep your appointments and see the physician and have good primary care, which includes taking blood pressure medication. So treating blood pressure is super important. Quitting smoking. If we smoke, that's a major risk factor.
Amen.
It's not easy, it's not fun, but you can add years to your life and prevent strokes and heart attacks by quitting smoking. Diabetes control is very important. So, in fact, when we see patients with strokes who come in with high blood sugars, they have a worse outcome just from stroke care. So having your diabetes treated aggressively helps prevent the stroke, but also helps you survive with less disability if you do have a stroke.
Right.
Regular exercise and weight loss is important. So those are all things, a heart-healthy diet, we call it, where you eat a lot of fruits and vegetables. The Mediterranean diet is a very important part of this, which is
a lot of fiber.
A lot of fiber, a lot of vegetables, olive oil, the correct kinds of oils are important. And doing those things can make it where you don't have to see me in the emergency room and have to worry about giving these medications.
Yes.
So basically the keys are prevention, number one, if possible. If you haven't prevented it, timing, recognition and timing.
Absolutely.
And then you can actually help us to
Yes.
remain healthy and active and get back to normal.
Right.
So thank you so much for being with us.
Glad to be here. Thank you.
Hopefully this will make a difference in somebody's life out there. So you stay with us and we'll be right back.